Hey everybody, welcome. I am Dr. Kevin.
I'm Coach Sean.
And we're the FitHealth Pros. So today we're bringing you two parts. This is part one of best exercises for chronic low back pain.
Yes.
So we see that a lot with the patients and clients that we treat. So we wanted to bring this to you, kind of a quick, simple, and easy one to show you how to do these things. So let's see.
Intro.
Statistically, we all have or are going to have low back pain at some point in our life. So that's the biggest thing here is, you know, there's really no way to get around it. Everybody's going to have a strain or a sprain. But the chronic low back pain, here's what differentiates that. It's going to be present for 3 months or more. Once you get more than 3 months, that chronic low back pain, it's increasingly difficult to resolve. So here's a couple of the things that can help us. So we have stabilization exercises. What are those, Sean?
So stabilization exercises that we're going to focus on to help both relieve your back pain and kind of get you to a point where that pain doesn't keep coming back over and over and over again, because we're going to be strengthening the core, strengthening the glutes, strengthening the hamstrings, all the muscles that need to be utilized.
Right.
In a full capacity for the lower back, not to kind of poke you on the shoulder and be like, hey, I'm going to help here. We don't need the help with the lower back on a lot of the basic movement that we do day to day. That's what all these other muscles are for. So with stabilization exercises, we're talking possibly Swiss ball, floor exercises, land-based exercises, etc. Now these have all shown improvement in pain and disability, increased bone density, waist isometric strength exercises, so you can move more easily within a trunk roll capacity, which you may not realize we do often.
Right.
You know, the sides, the reaches, the things that we do in a normal day-to-day propensity need to happen. So that is improved with stabilization exercises. Can also help improve pain and disability scores over time. Now without these, as we've seen in our own practices, many clients get worse if they're not doing some of these exercises, some type of core stabilization exercise. They're right back to where they started.
Right.
You know, we can heal them so much, but they got to do some work on their own too. So this is for all of you.
Right. And I think this is when someone says core exercises, I think the majority of the population, they hear it, but it kind of goes over their head a little bit.
Yeah.
These are the exercises that focus on the core. And
Right.
so
which isn't just the rectus abdominis.
Right.
It's not just the six-pack that everybody shows in the magazines and online, you know, Instagram, etc. Right. This is all the way around.
Right. So we're going to do Swiss ball, and we're going to work on balance, proprioception, stimulation. Okay? The nice thing about the Swiss ball is you're doing some exercises that are really short and concise holds, and so you're getting 35 minutes plus of what you would do on the floor, and you get that in 5 minutes.
Yeah.
So it's pretty cool.
You're activating not just the core, but a lot of the secondary muscle groups as well.
Yeah.
And getting more bang for your buck for the amount of time you're doing the work. So
All right.
let's jump in. Go ahead and take the ball down on the ground.
All right, Swiss ball.
Now with these exercises with the Swiss ball, when you're first starting out, especially if you're dealing with some tightness, dealing with some pain right now, you're going to want to be about 5 to 10 repetitions to begin with, just nice and easy. And then over time, as that inflammation decreases, as the pain decreases, as your core gets stronger, you can actually increase the amount of time that you're holding, that time under tension, the number of repetitions that you're doing. All of that can be increased lightly over time. We want to make sure that we're getting you out of pain first and foremost, and then a continuation of good health.
Absolutely.
So number one, we're going to talk about sitting pelvic tilts. Now these are, you're sitting on the ball, you got both feet flat on the ground. And then you can rock your pelvis
So I will rock.
back and forward. Now, when you're first starting out, having your hands on your knees is a really good, solid foundation to help control the movement.
Right. And so what you want to do, we actually do a form of this in the office where we have a special kind of a seat that wobbles back and forth and side to side in a circle, and it has a ball in there. Now, you can use these and do the same thing, but here's what I tell people. It's not this, okay? Your shoulders aren't going forward and back. Your shoulders are staying still, and your hips are rocking back and forth. So there's a different pivot. So everything is, it's down here.
It's all down here.
Right.
And that's what we're looking to release.
And you do. You're going to kind of, as you rock back and forth, to bring that pelvis up and back, I'm squeezing the lower abs there.
Mhm.
So that's the front to back.
It's called abdominal hollowing.
Right.
Is what you're doing.
So-
So from there, you can also go side to side,
All right, so side to side.
nice and easy. And this one might be a little tricky if you're having a flare up.
Right. And I'll tell people that recognize maybe what side's pulling. Okay? So I'm feeling a little more pull as I go to the right.
Right.
And that comes up what's called the erector spinae muscle into the mid-back. And over here, I'm pretty,
It's
Real
pretty
easy.
clear.
okay? Now, as you go through these, that should loosen up. And when you come back, you could always come back around, circle back, and do it again and see if
Go
that
up.
soreness goes away.
Maybe go a little deeper with it, you
Right.
know.
So this one going side to side, intermediate, you're gonna bring the arms up here. Now I like to have those shoulders going opposite, so I'm flexing the entire spine back and forth as well.
Yeah, it's not just the lower spine that's getting the work here.
The other thing, studies show that in this seated position, when you load the low back, all the focus of your body weight is on the low back and on the discs.
Right.
That's why, yes, there's abdominal hollowing, but you're using some gravitational forces in there too. Let me show you advanced.
And that's when you're at a rock concert, you can bring the Swiss ball with you.
Right.
And you're, you know,
All right.
can't necessarily bring
So-
a lighter with you.
If you're having a flare up, keep the hands there for stabilization.
Yep.
What's next one? Circles?
So next up, you can go into a circle.
Yep, circles.
And
So
again,
usually-
as you advance into these moves, you can do a little bit more. Your range of motion becomes a little bit more, and
Yeah, you can
it
come
really loosens up.
way out here.
'Cause this is an
You
active
can
stretch.
keep it kind of tight.
Tighter.
Yeah, this is good. Now, I had to do
And then
this.
reversals.
I mean, my whole back, abs, flanks, everything is tight as I'm doing that, and it's little bits of contraction. And that neuromuscular re-education starts to come into play, that proprioception. And we're doing it on the ball, so it's a stability.
Mm-hmm. Adds a little bit of an extra instability in there. So, like I said earlier, helps those secondary muscle groups activate as well. So these are the smaller muscle groups. They're not necessarily the main bigger muscles going up the back. So
Keep those
from
feet under
there,
the knees.
yeah, from there, we can go into a figure eight.
So figure eight. All right, so if I'm starting in the middle, I'm going to come out here, wrap around, come back through the middle, wrap down and around. That figure eight. I'm feeling a little hip involvement in there too.
Yep. You will get some of it, your hip will actually loosen up as well. We are not symmetrical creatures in terms of where the stress hits us throughout our body. So you will definitely feel one side of the lower back, possibly an opposite hip with the transverse process going on there. And then this is one of those exercises where you end up loosening both.
Right. So now that I've done those, we'll come back to the side to side.
Now, what do you feel in that
No,
lower back?
nothing.
Right, it's gone.
That's loose. Now if I come way over to the side, I mean,
You can feel it if you go,
Yeah.
you can get to it.
Right. So I probably, what I would do as a chiropractor is I need an adjustment. So get that lined up. And
It's like you're warmed up now, you're ready for
yeah,
it.
that'll totally go away with that.
Yeah.
Awesome.
Yeah. So number two, the bridge.
All right.
So on this one, you begin in a seated position and you walk the ball back in between your shoulder blades.
All right.
So just nice and easy. Again, if you're having a flare up,
Right. And so-
everything's slow.
And before I do that, what we're going to do is I'm going to position a chair right here, because once you get out there, if you're older, if you have weak abdominals, rolling back up into the seated position, which we want to finish up so we can dismount from the seated position. You may want to put a chair nearby, otherwise you're rolling over
Safety
on the floor.
first.
Yeah.
Safety
So,
first.
you know, I've done this. We do this every day.
So his core muscles are pretty strong with
it's
this.
good. You'll see at the end. I didn't practice this, and we'll see, but we'll roll out.
He's a little shaky when we were practicing.
I know. So
But
we'll
now he's
roll out.
warmed up.
So
So you're warming up. You're walking it out. The trunk is parallel to the
So
floor.
we're bridging. So I'm way out here,
So
up
you're
on my
way
shoulder
out
blades.
there. Exactly.
Here's the bridge.
So you can see that straight line going there from his shoulders to the backs of his knees.
Right.
So that's what we're looking for, that straight line.
Glutes.
Hello, glutes. Now you're pushing the heels into the floor, and this activates those hip extensors or those glute muscles.
And then here. Yeah.
So you
Stretching
got
here.
You're stretching the hip flexors and you're contracting the hip extensors.
We're holding that about 10-15
Hold
seconds.
about 10 to 15 seconds, and then you're going to walk back up into that seated position.
So I can use the chair and come back.
Just nice and easy. And
Or if I wanted to do it pretty quick, I can slowly
walk it back up
walk it back.
on your own. Now, if you have a flare up, you might not be able to walk it back up. You'll definitely be using that chair more.
Right. And the
Or
key
any kind of support next to you.
And the key is to make sure that the ball's the right height. That I could go up just a little higher on the blowing this one up,
Sure.
and that's going to make it easier to come back and down. Now,
Definitely.
the harder the ball gets, though, when you're sitting on it, more stability.
The more, you can roll off more easily too.
Yep.
So less air means that you can really sink into that seat and have a good strong stability. Next up, we're going to go, well, there is eventually you're going to alternate with one leg up at a time while you're in that bridge. But that is a more advanced form of strengthening. That's not necessarily from when you are in a flare-up.
Right.
So third up, we're going to do basic crunches. So on these, you're starting from a seated position.
Yep.
And you're just kind of nice and easily
Roll it out again.
rolling it out, and your body will tell you where you need to be on this. Generally, if you have a tightening in the back, you're going to want to have the ball
Maybe back.
kind of in the small of the back.
I feel it on the tailbone, on the sacrum a little bit here.
Sure.
If I come down a little further, then it's going to be more up on my mid-back. So this
Right.
may be a good rest position in between sets.
Right.
But right here,
That helps engagement
man.
of that core.
so much, it's nice and stable.
It's
right
taking
there
the
and there.
pressure off, and it's giving you stability right there in that lower back.
So then the crunch,
So then your crunch, right, you're just kind of rolling halfway back
yep, so right
and
there.
hold right there. So you're
Thumbs.
going to be getting, you will feel it throughout the core, but you're really going to be getting it in this upper ridge of the rectus abdominis.
And this isn't,
It's not, we're not crunching up. This is a crunch and hold.
right.
Okay?
So
Because
just,
we're
you can cross the arms, 1, 2, 3, and you know, if you start to shake like I was,
then slowly release. Now we're not just focused on strength, which you are building the strength, but you're focusing on strength stamina. So that means that your core will be able to take more throughout the day, every day, over time.
right.
And a stronger core,
Yeah. So if
Takes
I'm
that
holding
pressure
here,
off the lower
I'm
back.
going to have a little bit of tension through the neck, so I may want to, you know, just on my relaxation phase, come to here.
yep, you can,
And
you can
I like bringing the hands up because then I know I'm working.
that you're doing the work and that your hands aren't, the thing to worry about or to pay attention to, not necessarily worry, is that if you do use the hands here and you're pulling up, you can be tilting that head forward.
Right.
You want to always be doing the move from the core. That's why Dr. Fox has his hands here instead of there. Now, if you feel more comfortable here, make sure that you're pulling from here and not from the back of your head.
All right, I'm doing it. No.
You're not engaged,
Yeah.
right?
So I go here, I'm bringing those shoulders up.
Perfect. And then in order to come out of this, nice and easy, walk your way back up into a seated position. And again, if you need the chair, have a chair there or a table next to you, something solid so that it can help,
Right.
especially if you have a flare-up or a weak core, you know, etc.
Yeah, and I mean, even if you're at a flare-up I'd probably suggest maybe another person in the room with you too.
Sure. Make sure you're not falling off that ball and really up in that contraction. So next up, number 4, seesaw. So seesaw, you're going to hug that ball and you're going to roll it out into a push-up position with the ball under the pelvis.
We're coming out here.
Yes.
I like to get the toes and the feet out wide.
That gives you more stability.
You can do here.
The further apart your legs are, the more stability you're going to have for this exercise. So from this exercise, from this position, you're going to nice and easy lift one leg up toward the ceiling and flex that glute. Now what we don't want is to have an overextension which would activate that lower back. We're looking to strengthen the glutes on this with a light contraction of the lower back. But if you overextend, go ahead and overextend, Kev.
Yeah, so I could either overextend here, or I can even come up and
then you get it all through here.
Yeah.
This is all contracted now, so you don't want to do that either.
So, and then going back, since we're doing the feet, we talked about this wide stance, but since I'm doing the glutes, I might shoulder width apart, and then just stabilization, maybe the hands out a little farther, whatever's comfortable, bringing the hands out like that. But I'm kind of keeping my shoulders relaxed. You could put the elbows into the ball here.
Let the ball do the work for you in terms of stabilizing the move itself.
Yeah, I'm not lifting, keeping the legs straight, about right there.
All right there,
That's
and
good.
then
if I go too much,
that goes in the lower back.
yeah, it goes in the lower back.
And if you're having a flare up, that could cause spasms. So you want to be very
This is
careful
good.
with that.
Are we holding at the end?
You can hold for about 5 seconds, and then nice and easy on the release. Anytime you're doing any of these exercises, especially if the lower back has been talking to you a little bit, you're going to ease into the exercise, ease out of the exercise. And then ease off the ball.
Here.
There you go. See the position.
All right.
You can kind
feel
of
good with that. You can
move the ball.
You can use the ball. You can move the ball.
And use
Come
a
up
chair.
on the chair.
And voila. There are 4 super exercises for utilizing the Swiss ball for lower back pain.
Yeah.
So next video we're going to do is going to be floor core stabilization exercises. So more stability overall because you don't have this unstable ball.
Mm-hmm.
But there's a bunch of those exercises. So that will be in video 2. So keep watching because we got another one coming right now.
Go.
So we're the FitHealth Pros. I'm Coach Sean.
I'm Dr. Kevin.
Hopefully you found a lot of good stuff out of this. Go ahead and follow us, subscribe, like the video, and we'll be right back.
Yeah. See you.